Our final speaker is Jacques Spilka, who is a bladder cancer survivor. Jacques is also one of Bladder Cancer Canada's patient support volunteers, often one of the first people who truly sympathizes with patients after they've been diagnosed and helps to empower them with as much information and shared experience as possible. He's been with Bladder Cancer Canada for over 3 years and was responsible for starting our monthly support group in Montreal. Jacques.
Thank you, Dale. Before I get started, first off, by show of hands, how many people here are uniquely francophone? Combien de francophones uniques ici? OK, uniquement? Alors, je peux faire ça en anglais, ça sera un peu plus rapide. Merci. And how many people here, show of hands, are currently faced with either bladder cancer or someone close to them has bladder cancer? All right, captive audience. Okay, so my name is Jacques Spilka. I am a bladder cancer survivor. I feel like I'm at an AA meeting, but, you know, hi, Jacques. And in order to accelerate things, I did not bring any PowerPoint slides, so we won't run into any problems. My journey began, I don't think I need these. My journey began when I was, I think, 46. I was starting to wake up about 2-3 times a night, go to the bathroom, look on the internet. Yeah, this is what happens to men and when you're in your 40s. Go see the doctor, he gives me Flomax, it seems to work, life is good. But 10 years later, of course, I'm now getting up 2, 3, 4, 5 times a night. This is no longer very pleasant. I start to see the urologist, I go through a variety of different things, cystoscopies, to be sure. Those are a lot of fun. They stick a 35mm camera and they take a look in your bladder. And my life is getting more and more miserable to the point where I have frequency, all the symptoms you saw there, frequency, urgency, burning. My life started to focus on the bathroom. Where is the bathroom? How close is the bathroom? Can I get to the bathroom? I have a very good friend and we go for walks regularly. And I mean, I felt like the dog watering every tree that I saw. He didn't go once. But particularly foods that I ate, and certain foods that I ate tended to cause what I call a bladder attack. And that is that, boy, I got to go to the bathroom now. And 2 minutes later, I got to go to the bathroom now. Maybe 30 seconds later, I got to go to the bathroom now. And this was my life. So it's not a life. The urologist that I was seeing at the time did a variety of tests and so on and so forth, and the best he could tell me I had interstitial cystitis, and if you ever hear this term, take it from me, that means they really don't know what's wrong with you, but they're going to keep on looking. But I went to consult a naturopath, and I explained my situation with the foods, and she's, oh yeah, sure, I'll put you on an anti-inflammatory diet. And I tried it. And as long as I avoided the foods on the list, and the list is extremely long, I was fine. But if I cheated 24 to 36 hours later, I was in severe pain. So finally, I had enough of this, and I changed urologists. And then the first thing that a new urologist did was take a biopsy, a bladder biopsy, and then informed me that he found carcinoma in situ, which you heard, and the best course of action was BCG, and we should start the BCG. So sure, let's go ahead and do this. And the first 6 treatments were actually not bad at all. Yeah, what's the problem here? I've heard all kinds of problems. Nah, nothing. Great. I go on vacation. I come back. We do another round. And we do the first treatment. And the pain was intolerable. And this is what we talk about, the effects. And I went to see my doctor and said, look, unless we can do something about the pain, I cannot do this. So he scheduled a second biopsy. And they called me on a Friday. It's in November. And informed me that they had found a T1 tumor in my prostatic urethra. And given that I was such a young man, that the best course of action at this point was to remove my bladder. And it's really funny what happens to you when they give you that kind of message. You have cancer. And when your mind jumps to grasp on something, and I was 56 years old, and I go, they think I'm a young man? That's all I can focus on. And they give me a nice little flyer with 3 different kinds of things I can do to replace my bladder, the inside bag, the outside bag, the very high quality production. But they also informed me about a bladder cancer support group that was meeting on the following Wednesday and suggested I go to attend this. and this is the one that I'm currently chairing, and I did not create it. I just took it over after the previous person passed on, unfortunately. So I talked to my wife. We had a good cry. We tried to figure out to tell our children, and then we went to this meeting. And I knew nothing about bladder cancer, but or about removing your bladder, and it's a very, very scary prospect if you don't know anything. And all of you are facing this today. I can appreciate what you're thinking. And I went to this meeting, and it's just other bladder cancer patients, some with their bladders, some without, some going through BCG and whatever. And they started to talk to me about it and what to expect and so on and so forth. And then I asked, well, what's the biggest problem that you face when you have a bag? And one gentleman said, oh, well, you got to be careful about your skin. Skin is very important because you've got an adhesive on here. If your skin gets irritated, then you're going to have a problem. But don't worry about it, because if that happens, put an ointment on it. And this woman says, no, 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 you don't put the ointment, you put the powder on it. He said, no, the powder's no good, you put the ointment. No, 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 the powder, point. It's like an old married couple. And if this is the worst problem that I had to face, then I realized maybe it wasn't going to be so bad. So now it's a question of finding a surgeon to do it, because my urologist was 76 years old. He couldn't undertake the operation, which runs anywhere from 6 to 12 hours, I think. I'm not a doctor. So I went searching for somebody to do it, and I wanted a second opinion. And this is where the medical system in Canada goes into high gear. I was able to see 4 doctors in 3 hospitals in one day to get a second opinion to figure out what to do about it. And it was Dr. Taguchi at the Vic who put it succinctly. He said, basically, your urine is killing you. So my urine is killing me, the bladder's got to go. Now, who's going to do it? And I was extremely fortunate to meet Dr. Kassouf, who agreed to take me on as a patient, and said, now it's just a question of when I can see you, because I've got 3 sessions scheduled between now and Christmas, and if I can't get you in then it'll be after that. And as a bladder, or as a cancer patient, I don't mean bladder, just as a cancer patient, every day that you wait, you feel like you're closer to death. It's a very scary prospect. And this is before Christmas. And on 4 weeks later, after I'd been diagnosed and told that they were going to remove my bladder, I got a phone call from the Montreal General telling me that the patient scheduled for Wednesday morning had taken ill and would I like to take his place. So I said, sure. And I then spent the rest of the weekends, my fingers crossed, but please don't get sick, please don't get sick, please don't get sick. And showed up Wednesday morning with my wife in tow, and I put on the fancy blue gown and the nice stockings and kissed my wife goodbye. Everybody in the room is crying. I don't know what the problem is, and they wheel me to the operating room. And after that, it's a non-event, you know. They knock you out. You wake up. Got tubes. By the way, I opted for a bag, an external bag. So I wake up, I have 5 tubes sticking out of my body, but I don't care. Just control the pain. Control the pain. I wake up next morning. They take the tube out of my nose, thank God. The other tubes are fine. And then they come and do their rounds, and Dr. Kassouf comes in to see me. And it's one thing you have to know about the prospect of losing your bladder if you're a man is erectile dysfunctional, and there's always a possibility. And it's actually a 50-50 chance going in that you will have problems coming out. They don't know. They can't tell you until they get in there. And the first thing Dr. Kassouf told me as he walked in, he says, we were able to spare the nerve bundle. Oh, thank you so much. And then the next question is, have you passed gas yet? And you spend a lot of time focused on that. Eventually you get to eat, and eventually you start to feel better. And I remember waking up at 2 o'clock in the morning because the night staff was making a racket. And don't they know we're sick here? We're a bunch of sick patients in this hospital. Why are you making so much noise? And I get up to complain, and I walk out in the hallway, and I'm the only guy up. It's 2 in the morning. I guess I'm not so bad anymore. And they start pulling tubes out, pull the tube, and they check your no leakage, pull another tube next day, no leakage, pull another tube next day, no leakage. Great, I got one tube called the Jackson Pratt. Remember this? Because when the doctor comes to take it out, and if you ask him it's going to hurt, he's going to tell you it won't hurt him a bit. And yank! And it's gone, and the pain's over, and they patch you up, and they send you home, and it's convalescence. Now, you got to understand, for 2 years, I had been watching everything I'd been eating. And this is just before the holidays. You know when the clementines are really perfect? I haven't had citrus fruit in 2 years. And I had the world's most perfect clementine. And it was like like a firework of a citrusy goodness in my mouth. It was just amazing. And my sister-in-law, who'd been cooking meals for me at Christmas and for other occasions and putting stuff aside so I could eat, came and prepared 24 dishes in 2 days, and I ate them all. I was back. Now, things were good. We go on this maintenance, and we get checked every 6 months, and Beverly checks you out and takes care of you, which is really nice, and Dr. Kassouf was very good. And the nice thing about a 6-month verification is after 5 years, they saw something. So we go back in, and I had a thickening on my left ureter. They checked it out. I seem to have carcinoma in situ there. What are we going to do? They recommended taking out my kidney, but I am not so crazy about that idea. Can we save it? What can we do? So we decided to do BCGs in that area through a nephrostomy tube, which is a tube that's stuck into your kidney, in the back of your kidney, which is not so bad. And I have a humorous anecdote, but I'll tell you later if you want to hear about it, not during this meeting. And we did this for about 7 months. But in the end, unfortunately, the carcinoma was still there. We did one final biopsy, and okay, I give up. Let's take it out. And I was very fortunate. From the time I said, let's take it out, 9 days later, I was in the hospital. Dr. Kassouf once again removed the kidney, and it was non-event because you're asleep, you wake up. Recovery was not as much fun. But I got to see the Olympic hockey game women's final at the 2-minute and 35-second moment. I walked in and there it was, and we were losing 3-0, and I decided to stay and watch. It was amazing. But that has nothing to do with this. So then I got out of the hospital, I went home, I convalesced, I went to see Dr. Kassouf, and he mentioned that the pathology came back on my kidney, which appeared to be clear, but it turns out it had cancer. So the problem wasn't just in the ureter, but it was in the kidney as well. And adjuvant chemotherapy was probably a good idea if my kidney recovered. And my kidney took about a week, and the remaining kidney did recover, and I started the chemotherapy. And chemotherapy is not so bad except for the side effects, but then again, I'm told it's only side effects. And in that case, they are cumulative. But I went through 6 months of chemotherapy. Then they seen something, so I did 20 sessions of daily radiation therapy. And this was back in, I started the chemo in May last year. I finished the radiation in November last year. I had a CT scan in March this year, and it's the first time in my life, I'm glad when they told me it was unremarkable. I take unremarkable pictures, and I'm a very, very happy guy. Now, I tell you all of this because it's quite an adventure. But I think the way to go forward and to deal with cancer is to be positive about it. There is a tremendous support network out there. There's Bladder Cancer Canada. There are oncology nurses who are just the most amazing people you're going to deal with. There are tremendous surgeons who will take care of you. There are support groups. There are libraries. There's information online. You're not alone. But I think the most important thing is to look at it and to be positive about the outcome. If you go in there thinking you're going to die, I guarantee you, you will die. You've got to go in there and think that you are going to get better. Your body is able to heal itself. Yes, it needs help. And yes, thank God we have people here to take care of us. But most importantly is your attitude. Placebos work for a reason. People believe in them. You have to believe you're going to get better. It may or may not work, but it's not going to hurt you. View it as an adventure. I went through some amazing things I wish I didn't have to go through, but you know what? It's kind of interesting. I met some interesting people. I got great war stories to tell. When I show somebody my scar, I say, you should see the other guy. The important thing here is that bladder cancer is on the rise. We have to get more funding so we can get more research so those of us who have it can survive. We're seeing tremendous advances being made in other disciplines or other cancers. I'm glad to hear today that to hear that bladder cancer is similar to breast cancer in certain ways, because we know there's been a lot of funding in there, so maybe they can jump off of that. I want to thank everybody that I've met, Dr. Kassouf, Zvi, David, who's created this, co-founder for this wonderful organization, people in my group, and all of you who've shown up here today. For those of you who are in Montreal who are interested in hearing more, we have a bladder cancer support group that meets on the first Thursdays of the month at the Hope and Cope Center. On peut le faire en français pour ceux parmi vous qui ne parlent pas l'anglais, c'est pas un problème. We have a meeting this coming Thursday next week, which is our last meeting before September. If you want to find out more, you want to find out how to get by with a bag or an Indiana pouch or the BCGs, or what is normal and what is not normal based on people who have been through it, I encourage you all to come. You can get information on the website of Bladder Cancer Canada, to where to find it. And the other thing is I encourage you all to come out to the awareness walk and to talk to people around you, to donate, to solicit donations for bladder cancer support, and also, if you see blood in your urine, go see your doctor. Thank you.
Thank you, Jacques. You're most inspiring, and I have to totally agree with you. And unfortunately, with some people, it is very difficult to have a positive attitude at times that we're going through struggles. Not everybody has the same facility of doing that. Having said that, the importance of having that positive attitude is so essential to getting well. And we're so glad to see you, and you look so good. And I was so pleased to see you, I have to say. So thank you very, very much again.